Yo guys, it's your boy Sinking here. How's it going? Today I'm doing another podcast, and today I'm here with a very special guest who is
Dr. Smith.
Now, as you guys can already tell, she's a doctor. What do you specialise in?
Generally diabetes.
So, in diabetes, what is it that you do on a regular basis as a doctor?
So most of what diabetes is done with the young people out in the community. So I do clinics once a week, all day on a Monday, where people come and see me and we just talk through their diabetes management. Sometimes people come into the ward, or someone will have a new diagnosis of diabetes, and then I will go and see them on the ward.
Is there, obviously, diabetes has a lot of things that come with it. So could you give like a little overview for the listeners of what diabetes is in case someone doesn't know?
Okay, well, the people I look after with diabetes have got type 1 diabetes. And type 1 diabetes is a disease which you get by bad luck rather than anything else. It's certainly not at all associated with eating too much or being too fat, which I think a lot of people think that diabetes is. So my young people that I see with diabetes generally have got type 1 diabetes. And with that, what we ask them to do is give themselves insulin. Every single time they have something to eat, we ask them to give a dose of insulin. We ask them to count how much carbohydrate they're eating and tailor their insulin dose according to that. And then they have another insulin injection at bedtime, which just sort of helps them through the night. And so it's pretty full on, their treatment. And I think I have to ask them to work quite hard.
Pretty much. I'm diabetic myself, and Dr. Smith is the top dog of my doctor. And yeah, I understand completely what you mean by hard work. Now, you were saying insulin. So some people don't know how that insulin is produced. So first off, could we start off with how insulin is produced in someone without diabetes?
Yeah, so insulin is produced in an organ of the body called the pancreas, which sits inside the abdomen. And within the pancreas are cells that produce insulin. And they produce the insulin, and that insulin then gets directly into the bloodstream, and that keeps your blood sugars really, really stable, somewhere between 4 and 7.
So how is insulin different from someone who doesn't have diabetes to someone who does have diabetes?
For reasons that we don't really know, people who have diabetes, who develop type 1 diabetes, their own body produces some cells that fight the cells in the pancreas that produce insulin. And it's only those cells, it's not the other cells in the pancreas, it's just the cells that produce insulin. And they fight the cells that produce insulin and gradually, one by one, kill them off. So normally when people come in with a new diagnosis of diabetes, they've lost about 80% of the cells in the pancreas that produce insulin, and they can't produce quite enough insulin anymore. So those cells die. Gradually, then they get to the point where they recognise that they've got a problem, that there's something wrong with them. They come and see us, we do a blood sugar, we recognise their blood sugar's high, and we recognise that we have to give them some insulin to keep them alive, basically. Then what happens over the course of the next year is that all of the rest of the cells that produce insulin in the pancreas are also killed by your own body, so that you have no ability to produce insulin anymore at all. So the young people I look after with diabetes, they have no ability to produce insulin and are completely reliant on the insulin that they have to inject.
So I've read online a couple of different things about the insulin. Is the insulin that we use artificial, and where does it come from?
It's a really good question. So the insulin is completely artificial. It's based upon human insulin. So what somebody very clever did some years ago is worked out what the DNA structure of human insulin is, and they now manufacture that in the lab using bacteria.
Okay, so that's quite cool. If you guys didn't know that, I didn't know that myself, and I'm diabetic. So you were also saying things like people who have just been diagnosed. What is the step-to-step basis that you do when someone's just been diagnosed to help them? Because I remember when I was first diagnosed, I was quite young and I was very upset at that moment. So is there like a new step-to-step way of doing things for that?
Yeah, so normally what happens is people have fairly standard symptoms if you're having a diagnosis of diabetes. So the standard symptoms are that you're drinking a lot, you're weeing a lot, you're feeling very tired, and you've lost some weight. If you add those 4 things together with a high blood sugar, then basically that's diabetes. We've got a really excellent team here at Northampton that works around our young people with diabetes. So basically what we do is we mobilise the diabetes team, and we all gradually at different times come and see that young person on the ward. First person to see them might well be the diabetes nurses, and then they might write up, or the doctors on the ward might write up the insulin. So the first thing that we do is give some long-acting insulin, which is the nighttime injection, and teach people how to do injections. We then teach people how to do finger prick blood sugars, which they have to do every single time they eat. And then we write up that insulin onto a drug chart and get them going with learning how to do that. Insulin in the first place is a very, very practical disease. And again, you might remember that, but it's very practical. You have to learn lots of new stuff. So we get them to inject, we'll teach them how to inject insulin, teach them how to do blood sugars, and then gradually we work out what the doses of insulin are that are right for that particular young person. And that's a continuing process through time.
So I personally have a pump. Now, for some people who don't know what the pump is, could you explain to them what it is instead of injecting?
So if I start with injections first. So in injecting, you have one insulin injection, which is called a basal injection, and you mostly give that at night. And then every single time you have something to eat, you have to inject yourself each and every time, tailoring that, as I said already, towards how much carbohydrate you're eating. On a pump, what you have is just short-acting insulin, but that pumps insulin into the body all the time, 24 hours a day, and that's equivalent to your basal insulin injection. Then on top of that, you still have to carbohydrate count, you still have to work out how much insulin to give yourself, depending on your blood sugars and how much carbohydrate you're having. And then you'll ask the pump, very politely, if it will give you that insulin to go with your meals as well.
Now, there's also another type of diabetes. So there's also type 2 diabetes.
Mm-hmm.
What's type 2 diabetes?
So type 2 diabetes is probably, although no one's entirely sure, but probably a different type of diabetes. Very commonly, people with type 2 diabetes are overweight, and sometimes if you're overweight, you develop type 2 diabetes and you lose weight, it can go away. But in type 2 diabetes, in fact, you've got too much insulin rather than not having any insulin. So in type 2 diabetes, you become resistant to insulin. So your pancreas has to keep on pushing out more and more and more and more insulin because your body doesn't respond to it very well. And so lots of people with type 2 diabetes are either on tablets or some of them are on diet controlled. If they remain a type 2 diabetic for a long, long time, then sometimes they can need to inject themselves with insulin as well. But it's much more common than type 1 diabetes, but the way you treat it is very different.
So are there any specific age ranges for both diabetes, or is it just it can happen whenever?
For type 1 diabetes, there's no particular age range. There's a couple of peaks. So for the young people I look after, the biggest peak is probably in the teenage years, between 13 and 15-ish. But every year we get new diagnoses which can occur at any age. For adults, again, they can develop type 1 diabetes at any time. For type 2 diabetes, it largely depends on your weight and some of it's your age as well. So if you're very young, then you can develop type 2 diabetes in your teenage years, but that's very rare and you're normally very overweight. Generally, sometimes you can get to type 2 diabetes as well throughout all of the age ranges, and sometimes when you're older, you get it. You don't have to be overweight, you can just get it because your pancreas gets a bit tired, I suppose.
So if someone is feeling concerned about they've got these like symptoms that makes them feel like they've got diabetes or of something like that, what could they do to maybe calm themselves down, or to, I don't know, is there anything they could do?
If you have the symptoms of drinking too much, weeing too much, losing weight and feeling very tired, then you go to your GP and you ask your GP to do a blood sugar on you. You can't make it better. There's nothing you can do to make type 1 diabetes better without coming to medical attention and having some insulin. So if you're feeling like you've got the 4 T's, I've got to remember what they are now, tiredness, can't remember what they are, but anyway, it was a 4T campaign, but it's about drinking too much, weeing too much, weight loss and being tired, then go to your GP and ask him to do a blood sugar. It's an essential thing to do if you feel like that.
And what is is there any like future for a cure for diabetes? So Do you see anything in the future happening?
I think there's lots of exciting things that happen all the time in diabetes. I think a lot of them, we're always keeping an eye on research and on what's going on. At the moment, there's no cure for diabetes, but we're just starting the first few trials of looking at whether we can prevent diabetes. I think we're a long way away from that, but I think we're starting the first few trials of looking at family members of people with type 1 diabetes, seeing if any of those have these funny things that kill the cells in the pancreas, and following them and seeing if in any way we can form some kind of vaccine or some kind of way of preventing type 1 diabetes. We've yet to find a cure. There's been lots of things that have been, oh yes, this looks really good over time, and then it's like, oh okay, that doesn't work, and then oh yes, this looks really good, oh no, that doesn't work. And so we're always looking for a cure, and research goes on all the time looking for something that we might be able to do as a cure. I think the treatments get better. I think pumps are used much more. I think the pump, potentially a pump where it's attached to a glucose monitor, where the pump actually the glucose monitor tells the pump how much insulin to give, rather than the person having to be pricking their finger, etc. So what you call a closed loop pump. It's always been out there. We've still not quite made that perfect, but they will continue to strive to do that to help the people who already have type 1 diabetes. So there's loads of research goes on all the time about type 1 diabetes I'm talking about.
And one kind of strange question, but it's just popped up in my head. Is there something that you love about your job in terms of like diabetes, and is there something that brought you into this job?
I can tell you what I love about it now. I think what I like about diabetes is getting to know the young people that I look after well. I see them at least 4 times a year, and I get to know them well. I get to know their families well, and hopefully I get to help them through what is the really tough time of having type 1 diabetes. Because at any given moment, people find it very, very difficult to put in all of the really hard work that they have to put in to keep their diabetes well controlled. So I enjoy being with what I consider to be the really brave people that I look after with diabetes, who work so hard to make it good. And I like helping them and working together as a big team to do the best that we can for the diabetes.
And I think this will probably be the last question. What do you hope, actually second to last question, because I've got another one popped up in my head. What do you hope to see in the future when it comes to diabetes? Is there any hope or aspiration for you?
There's always hope. There's always hope. One must never ever imagine there's a life without any hope. So I would hope that we continue to strive for a cure for diabetes. I also hope that, and we'll get to that cure for diabetes, I also strive for and hope that they find a prevention for type 1 diabetes, because I think it's a massive burden to the young people who have it, to the families of the young people who have it, and on top of that, it's an enormous financial burden to the NHS. So if they managed to find some kind of way of preventing or curing type 1 diabetes, then that would be a lot better for everybody. Is that what you asked me? Yes.
I think so, yeah.
Yes, I got caught up in my answer. So my hope would be that we continue to strive to find a cure or a prevention for type 1 diabetes.
Okay, and the final question. This is the final question, guys. Is there any side effects to diabetes? So how can it affect your lifestyle?
So diabetes, you need to keep type 1 diabetes well controlled, and we spend a lot of time talking about that with the young people that I look after. So you need to keep it well controlled, and that's because if you don't, it has a very adverse effect on your body in general. So it affects the nerves in your body, and it affects the really small blood vessels in your body. So what we aim to do is keep people well controlled so that they do not develop any eye disease, which is possible, so they don't develop any kidney disease, which is possible, and that they don't develop any nerve damage, which means that they can't feel their feet, which can be very dangerous in terms of getting cuts and that kind of thing. But so it's mostly eye disease, nerve damage and kidney disease, but we work really hard to make sure that people don't get those.
And if anyone has any questions, is there any way that someone can contact the GP or you or anyone like that?
I think the first port of call is always to go to the GP. I think there's loads of good material online about diabetes. If you want to know more about diabetes, there's 2 what I think are really good websites. So there's Diabetes UK. That's an excellent website which has a lot of good information on it, just if you're interested in it or if you're worried about it at all. Or the JDRF, The Juvenile Diabetes Research Foundation also has some really good information on type 1 diabetes. If you're worried about yourself, then go and see your doctor. I think that's absolutely essential.
Okay, well, thank you very much, Dr. Smith, for the interview. If you guys have any other questions, leave them down in the comment section below, and I'll try and get Dr. Smith to answer them. And other than that, is there anything else?
Thank you very much.
Thank you, and I'll catch you guys in a bit. Peace.